Hello everyone, I am Dr. G.V.Subramaniam. I am an orthopedic surgeon. I lead the trauma team in Sunshine Bone and Joint Institute. I am here to talk about fractures in elderly people, that is geriatric population. Is old age a curse or it is a boon? You can always make it as a boon by having a healthy lifestyle and having a good family support. In India, geriatric population is gradually increasing. By 2030, the population is going to go up to 200 million, and by 2050 it's going to increase up to 320 million. The commonest problem which we see in elderly people is osteoporosis, fractures in elderly people. According to WHO, more than 6 crore people of above 60 years of age group suffer from osteoporosis. Compared to Western population, osteoporotic fractures are seen 10 to 12 years earlier in Indian population. About 4.5 million women suffer from spine fractures above 60 years of age group, and every year more than 250,000 patients present to us with hip fractures in India. Approximately 80% of the urban population suffer from vitamin D deficiency. As we all know, prevention is better than cure. I am going to talk about preventing these osteoporotic fractures in elderly age group. So what is the most important cause for these fractures? That is fall and road traffic accidents. But fall is the one which we have to concentrate more on. So what causes this fall? There are intrinsic factors, extrinsic factors, environmental factors. Coming to intrinsic factors, these are patient related factors. So we need 3 important senses to prevent us to fall. That is sensations, visual senses, and auditory senses. There are certain conditions like diabetes which affects our sensation. This predisposes the elderly people to fall. So coming to eyes, cataract or retinal detachment causes blurring of vision and blindness and predisposing elderly people to fall. So in this population, they have to get thoroughly evaluated and they should know from what they are suffering, and that has to be treated to reduce the number of falls. So coming to extrinsic factors, that is the medications what they take. There are certain medications like antipsychotic medications or anxiolytic medications which causes drowsiness, predisposes them to fall. And other medications which are used for hypertension like diuretics, they can cause postural hypotension and thereby predisposing them to fall. If there are any such incidences, they are supposed to contact their physician and adjust the dose accordingly. So coming to the environmental factors, they play a more important role because more than 60% of the patients present to us with history of fall at home. The environmental factors actually starts off from bedroom itself. Your bed should be of sufficient height. It should not be too low because osteoporotic fractures are seen in elderly when they fall from even a standing height or while sitting on the bed or while getting off the bed itself. So the bed should be of adequate height. Coming to the flooring, it should be of anti-skid. So next thing, going to the bathrooms, they should have anti-skid tiles. To take bath, they have to sit on the chairs. And to use the commode, they should have sidebars so that they can hold them. With the help of it, they can sit or get up off the commode. And coming to other general features is they should have railings to the bed so that it can help them while getting off the bed. And or while getting down the stairs, they should have strong railings, and they should have good lighting in the house so that they should not fall. It prevents them from falling. Going to the kitchen, they should have the cabinets at a lower level, and they are not supposed to use any sorts of ladders at home which predisposes them to fall. So these are the basic environmental factors which they have to look into. So next, a healthy lifestyle, there are 2 important things. One is diet and the other thing is exercise. Exercise, they should axially load the skeleton, that is brisk walking, jogging or hiking, whichever is possible for them. What happens is this strengthens the underlying bone. And next thing is they should even try to maintain a minimal tone for the muscles or minimal strength. What does this do is it helps us with a good reflex activity so that while if you fall down, right, so it gives you a support. Next thing is a healthy diet. You should try to have a diet which is rich in calcium and vitamin C. So these are the 2 ingredients required to have a healthy bones. So we all know that milk and milk products are rich in calcium. Other than that, there are few more things which are commonly available for a common man also. For example, ragi and sesame seeds, highest calcium content. And next is vitamin C. We all know that vitamin C or citrus fruits are rich in vitamin C. So having an healthy bones makes your bones stronger, thereby resisting fractures even when you fall. So next thing is in lifestyle adjustment is you have to quit smoking, you have to limit your alcohol intake. Other than this, if you are above 60 years, you are supposed to get a bone densitometry done, at least to know whether you fall under the group of osteoporosis or osteopenia, and thereby you can start your medications.